Welcome to T's Voices, telling the stories of the people in our NHS community.
With your hosts, Jennifer Trafford
and Alison Kerr.
So today we've invited Claire along from our podiatry team. Welcome to the podcast.
Hi Claire. So first question to kick it off. What's the difference between a podiatrist and a chiropodist?
Right. Not much difference at all, really. Chiropody is an old-fashioned term, really. It's a very British term, and it's formulated from Greek words meaning hand and foot physician. We just look at feet. Podiatry is a foot physician, and that's what we specialise in.
So you're a podiatrist then. What type of things do you see and do on a daily basis?
So we assess patients first and foremost to see how at risk they are. We are ultimately trying to avoid limb loss. So we will check circulation, make sure the blood flow is reaching the foot to keep everything healthy. We will check sensation to make sure people are aware of hot, cold, pain, touch, perception. We'll look for deformity, any pressure areas that could heavily load, that could break down and ulcerate. When we find people who are at risk, people who might be immunosuppressed, they might have had active foot disease in the past, for example, dialysis patients, we will keep them and we will look after them lifelong. And ultimately, we aim to prevent problems. However, patients can appear with issues or concerns that we might need to treat, might need to heal, and then it's a case of making sure that never happens again and keeping that person mobile, intact and on their feet. The other area we look at is we might have a course of treatment for patients. So it might be they might have a need for nail surgery. So somebody with an ingrown toenail in a lot of pain, a lot of discomfort, might be on antibiotics. We can do a procedure under local anaesthetic where we can remove a section of nail permanently. So they end up with a smaller nail, a narrower nail. So the bit that causes all the problem isn't there anymore. And they can go on and live a happy life without having to worry about an ingrown toenail anymore.
So it sounds like you're dealing with a lot of different types of patients. I'm going to be honest, I assumed that the majority of the people you spoke to would be the elderly, but that doesn't sound true, isn't it?
No, definitely not. Well, obviously, our at-risk patients, usually the older people are, the more likely they are to have, conditions that would put them at risk. But for nail surgery, we have a lot of younger people come in for that. We tend to put extra clinics on in the 6 weeks holidays because kids don't want to take time off school, or maybe his parents don't want them to take time off school, should I say. And we also work in biomechanics, and that's looking at foot function and mobility and how forces work through the foot. We might be need to provide orthotics and stretching or strengthening advice. And usually people who are more active tend to develop biomechanical concerns and issues, so they're our younger team as well. And sometimes we'll get referrals and it'll be a low risk person who might have a painful corn or calluses or concerns or pain in a certain area, who we will advise and maybe give them some treatment before we discharge them. But we only hold on to the at-risk patients and packages of care for patients who might need to come through the service kept on the feet and healthy and happy and looked after.
So it's really interesting listening to you talking about falls, because we had the falls team in recently. So we know that that's a big priority for the trust. So I'm assuming that you spend a lot of time in the trust helping with falls prevention and things like that.
Unfortunately, we're very much community-based. We do have the diabetic care team and the MDT team that work in the hospital who provide outpatient services and inpatient services for the hospital. Demand is increasing and we've got an ageing population that are living longer and developing more complex needs. We do know that there is a need for podiatry within the hospitals, but unfortunately, it's not set up.
If other centres are doing this kind of thing, because I've heard other centres have got inpatient podiatry, it seems like a really missed opportunity for the podiatry team to work with the falls team to help prevent falls, which is a massive issue we've got. Why do you think that it's not a service that is currently here or offered at South Tees?
I'd like to see it come in the future. I definitely think there's need for it, and I think it's just understanding what podiatry is about and what we can do to get these patients up and mobile and on the feet and pain-free, to get them mobilising and doing what they need to do to get discharged and home from hospital, certainly.
What do you think you'd need in the workforce to be able to build something like that?
Well, we do have 84% of our podiatry workforce are over the age of 35.
Wow.
Yeah. And when you look at the HCPC data, we lead the way on the over 50s, 60s and 70s in our profession. The numbers coming into the profession, unfortunately, I don't know why, but it's not a popular career choice for some people, whether or not we just need to promote it more and get it out there that, it's a wonderful job. We can help people. We get thanked repeatedly. We have the ability to make a difference with our own hands, with treatment. But we found that since 2012, numbers have declined. We've found that, changing the bursary and funding, we had a massive drop in numbers taking up podiatry, and then obviously COVID as well. So we were just finding that we needed to really boost the future workforce really, and have that provision, that pipeline coming in.
So for people who might be listening to you and thinking, actually, this isn't a career I thought of, but I am now, what routes into podiatry could they take?
Well, there's 13 schools of podiatry. They've been around for a very long time, but I'm really pleased to say that as of last year, Sunderland took on the apprenticeship, which is amazing. And we have 2 apprentices who are with us currently, Daniel and Karen, and they are absolutely amazing. Karen actually came from theatres at James Cook, and she's brought lots of, great shared care on our aseptic technique, and, do our Loxit forms and things like that. And she's amazing at what she does. She's very much hands-on, and she's not put off by gangrene, pus, blood and smells and things like that. And then we've got Daniel, who in his own way, he's absolutely excellent. He's very much MSK focused. They both have previous degrees and set on podiatry. They know what it's all about. And Dan's had time in the lab, and his empathy and everything, how he gets on well with patients. It's wonderful as a team to see them growing and develop, and to be part of shaping the future workforce, and they're going to be absolutely amazing podiatrists.
So what's your role within their development then?
I'm promoting podiatry, so part of my role with the apprentices is to work with them. So they have a day at university and they have a day with me in clinic. So we will go through and make sure they're meeting their standards, and we're hitting all their objectives, and collecting their evidence, and building their portfolios. And we also have, in my new role as well, I'm going out into schools, doing workshops, talks, education sessions to promote podiatry. What we know from the HCPC data is predominantly podiatrists are white, female. I think it's 1 male for every 4 females. We need to attractive society.
Population.
Yeah, for our population, exactly. So we've finally got our first work experience students coming through from talks I've done, and I've been counting up all the event forms that I've filled in, and I've reached out to over 2,000 students, which is wonderful, and promoting and saying what it's all about and what we do.
That's amazing, that, Claire. And I have seen it firsthand as well, the amount of effort you've been putting in for the careers, and it's a big credit to you why people wanted to come and be a podiatrist. Also, just understanding what podiatry is, because now we're getting work experience people coming in with referrals for podiatry. We've had a prospect student come in to want to go to podiatry. I mean, this is unheard of. So you've managed to flip the profession on its head in terms of the promotion of it. And now we have people coming in wanting to be podiatrists, and that's thanks to you and the podiatry team for all the hard work you've done, and it's amazing.
It just shows, though, doesn't it, the need for somebody in a role like you've been given the opportunity to go out there and promote, and it shows that it works, and you're reaping the rewards of that now. And when you look at the stats of, because I was really shocked by the ageing population of your profession, it must cause you some concern when you think about the future of it.
Well, we are, because we a lot of trusts are saying that 20 to 30% of their workforce are due to retire in the next 5 years, and we need to know where the next lot of podiatrists are coming from, especially with everybody getting more complicated, and the need for podiatry. And we know every hour of every day there's a toe, foot, leg amputation happening for diabetic patients, and 4 out of 5 of those procedures were avoidable.
Wow.
Which is massive. And we know that Diabetes Care, they're an amazing team, and their corridors are full. They've got overbooks, they're doing everything they can. We need that team there early on, education and talking to patients and preventing them from getting to that point. It's really important.
Absolutely, and it just shows the importance of our podiatry team. It's been absolutely fantastic talking to you, and again, every time we get together, I learn something new about what you do. So I'm sure we will invite you back to talk a little bit more, because there's so much more that we've got questions for. But in the meantime, thank you for coming. Look after yourselves.
And each other.
Thank you for joining us. Till next time, you've been listening to T's Voices.